Dr. Jeff LaCour with Compasio Medical Education. So when should you send a patient with a sinus infection to the ENT provider? I would say after 2 failed broad spectrum antibiotics if they're still having symptoms. Also, if they've had sinus surgery, you might have something like this patient had. Let me show you. So here we are, this is a left nasal cavity, this is the middle turbinate, this is a patient of mine that had sinus surgery. You can see that I'm grabbing with an alligator forceps thick mucus, and look at how viscous this mucus is, okay? This patient has allergic fungal sinusitis, and this patient often needs debridements. So if I give this patient an antibiotic and maybe even a steroid, they're not gonna get that much better. All right, here's the same patient. You can see how viscous that mucus is. We have a pretty thick lumen suction right here, and you can see that in order to get this stuff out, an antibiotic is not gonna get this done. It's taken a lot of forceful suction to actually help that viscous mucus separate from the sinus cavity. All right, so good rule of thumb. If a patient fails 2 broad spectrum antibiotics, send them to the ENT provider for a possible culture. Also, ask if your patient has had sinus surgery in the past. They may have something like this patient had and need a debridement. If you like this content, please like, subscribe, and share to help us grow. Also, for more content like this, please check out our courses for APPs, medical residents, APP and medical students at CompasioMedical.com. We'll see you there.